They are minimizing the amount of treatment that they provide, and that allows them to save a buck or two on the outset. However, people are dying as a result.
The medical provider at Alameda County's Santa Rita Jail is the target of lawsuits and complaints about a lack of care for inmates. These new allegations come 6 years since a KTVU investigation into the previous healthcare provider.
One that prompted Alameda County's Board of Supervisors to hire a new company. New at 10, KTVU's Brooks Giroux on what, if anything, has changed since then.
That new company is called WellPath, and since it took over medical care here, we found WellPath has been sued at least 500 times across the country. The company says that's the wrong measurement for quality of care, and the sheriff stands behind WellPath's contract, its policies, and its staff.
My son, I miss him so much. The biggest pain I have ever felt in my life, my only son.
Hector Hernandez Jr. died of pneumonia at Santa Rita Jail, but he also suffered from mental illness. His dad says he had schizophrenia.
It was painful for me to see that he was losing his mind.
Still, he often visited with his son to talk about the happy times or conditions behind bars.
He told me, in Santa Rita, if an inmate suffers something, an illness or an accident, whatever it is, it takes a long time for medical attention to arrive. I said to myself, God, please take care of my son inside jail. I hope he never needs medical attention inside.
But he did, developing an infection that attorneys say went untreated at Santa Rita.
They were required, based on their policies, to check on him roughly every 15 minutes, and they didn't. And had they checked on him, he probably would be alive.
His parents' lawyers have since filed a wrongful death lawsuit accusing Alameda County and medical provider WellPath of not delivering appropriate medical care.
This is taxpayer money that's being given to a company that's not fulfilling their end of the bargain.
Complaints like this are not unique. A volunteer advocacy hotline for Santa Rita inmates logged 1,000 calls since August. Half were claims of medical neglect.
We can't handle it no more. We just need help here. Please, somebody help us here at Santa Rita.
New allegations come years after a KTVU investigation exposed staffing shortages, questionable medical decisions, and gaps in oversight by Corizon, the previous healthcare provider at the jail. That pushed the Board of Supervisors to hire a new company, WellPath, at a cost of at least $45 million a year.
How would you rate the medical care at Santa Rita?
Well, I would rate it outstanding.
Sheriff Gregory Ahern says things have changed since Corizon was booted. More nurses, more programs, more attention.
Our nursing staff goes through the housing units 3 times a day. So there's a pill call, there's a medical call, and anybody that wants to see a nurse simply makes a request, and they get placed on a list and are seen as quickly as possible.
WellPath's president told us Santa Rita Jail is one of our Triple Crown accredited sites, and we are proud of our work there.
Stop thinking about the medical profits you can make from providing these medical services in jail. Look at the inmates as human beings.
Even with more nurses making the rounds, KTVU found there have been nearly 30 deaths since WellPath came in. A third of them suicide, others dying from natural causes or medical complications.
They need to provide adequate medical care and medication and treat these inmates even in outside hospitals if necessary to prevent these preventable deaths.
Sometimes we have been out of policy and out of procedure, but we've been put into a position of impossible actions based on the amount of funding and staffing that I have at the jail. We're asking people to do impossible things in difficult times.
What do you want to see done?
Justice. I want justice because my son cannot be brought back to life. But this has to change.
Brooks Giroux, KTVU Fox 2 News.